Hi, good afternoon, Mr. Ibarra.
Hi.
Is Jose your first name?
Yes.
Do you want me to call you a different name?
Joey is fine.
Joey? Okay. My name is Alyssa. I'm going to be your nurse today, and we're going to do a health assessment on you, okay? Let me wash my hands. Okay. So we're going to get started with your head, right? And your face, and your neck, and your ears, and your eyes. So first of all, I would like to inspect your head. Do you give me permission?
Yes, ma'am.
Okay, so we're just checking for any deformities, any lumps, any lesions. Your skull's in the round shape, no irregularities, normal cephalic skull. Everything looks symmetric. Good. Okay, let me go ahead and check also your facial expression. You look a little nervous. Are you nervous?
Yes, ma'am.
Okay, that's fine. We're gonna go ahead and check your cheek area. Everything looks symmetrical. Your eyelids look symmetrical. Your eyebrows look symmetrical. No drooping on any side. If we did have drooping, then we'll be concerned for Bell's palsy or a stroke. Okay, so we don't have any of that, so that's good. We're gonna go ahead and inspect your neck. Looks symmetrical. We don't see anything on here. What else? We're also checking for any deviation of your trachea. It looks symmetrical. We don't have a deviation to the left or to the right. If we did, then we would be concerned with a pleural effusion or a pneumothorax. So everything looks symmetrical. Just make sure no irregularities, no bumps, no masses, nothing like that. You don't have any concerns for your cheeks or chin, any masses, any bumps that you noticed?
No.
No? Okay, I don't see any either. Okay. We're also going to be checking your lymph nodes. So the body has several lymph nodes. A lot of them are located on the upper part of the body. So we'll start with the periocular, which is the front of the ear. So you don't have any tenderness or pain?
No.
Okay. So those are the preocular lymph nodes. We also have the postocular, which is behind the ear. Do you have any pain there?
No.
Okay. We also have occipital at the base of the skull lymph nodes. Everything feels good. They don't feel swollen. We also have parotid, so we can check the parotid on top of the parotid gland. You don't have any pain or tenderness on this side?
No.
Okay, then we also have mandibular, which is under the mandible. You don't have any tenderness or pain?
No.
And then we also have the submantle, which is under the chin. And everything feels fine. I don't feel any swelling, and you don't have any pain, correct?
Correct.
All right. We also have the supracervical ones, which are the ones that are on top right here. I don't feel any swelling. And let me check the deep cervical ones, and they feel fine. And we also have some deep posterior cervical chain lymph nodes, and those feel fine. I'm just going to go ahead and check here. This is your clavicle, and we have some down here. You don't have any pain or tenderness to this area?
No.
Okay, good. And the tonsil lymph nodes feel fine. So no pain, no tenderness to the lymph nodes.
No.
Okay, so we're also going to check your thyroid gland, which is in this location here. It's a little bit of a butterfly shape, so I'll be just palpating it really quick here. Can you swallow for me? Okay, so I don't feel any movement. I don't have like a donut shape in the neck, so we don't have any issues with your thyroid. No history of thyroid problems?
No.
Okay, so we're just going to go ahead and auscultate for a brewery real quick, which is a little whooshing sound that we hear on top of the thyroid, okay?
Mm-hmm.
Okay, that's good. Sounds good. Alrighty, so here. Now we're also going to inspect your nose, okay? So I'm looking at your nose. Everything looks symmetrical. You don't have any swelling or anything like that. It's in midline and it's not deviated to one side. We're going to check with the speculum, which is this little tool. We're going to check inside the nostrils, okay? Can you look up for me? We're just checking if the nasal septum is in line, midline, which is good. It's not deviated to either side. You can rest your head. It's not deviated. You don't have any redness, no boils, nothing like that. Do you have anything that is bothering you with your nose?
No.
No. Your nasal cavity looks pink and it looks good. It doesn't look red or anything like that. So we're also going to be checking your lip area. Your lips look fine. They look pink. They don't look dehydrated. You don't look like you're dehydrated. So we want them to look pink. If they were to look a little bit ashy, then we'll be concerned with a little bit of dehydration. But they're pink and they're moist, so that's fine. So we're also checking your mouth area. Can you open up your mouth a little bit? Just gonna check real quick. Okay, so the cavity looks pink and smooth, so that's good. Let me look at your teeth really quick. Okay, your teeth look good. You're not missing any teeth. Can you say "ah" for me? Okay, no cavities. Good. Go ahead and let me just, if you can say "ah" for me, please. I'm just checking the back of your throat. That's good. Checking your uvula, it raised up, which is what we like to see. Your tonsils aren't touching. Everything's pink. Nothing looks swollen or inflamed. Can you stick out your tongue for me, please? Okay, so you do have, like you said, and you mentioned in your past history that you do have grooves on your tongue, which is consistent with geographic tongue, so we can see that. But everything else looks fine. Okay, we're going to be checking your ears, just feeling over them for no lesions, no bumps. Everything, the size looks good. They're symmetrical, they're midline. They coincide with the inner canthus of your eyes. So the palpation, we don't feel any lesions. Do you have any pain in your ears?
No.
No? Okay, I don't see any drainage, no clear drainage that would indicate a basal skull fracture, and no like frank blood that would indicate like trauma, nothing like that I don't see. So we'll go ahead and start with the test for hearing. It's called the Weber test. So this is a tool that I'm using. This is a tuning fork. So I'll be slamming against my palm, and then I'll put it on top of the head, and whenever you feel that the vibration stops, you let me know, okay?
And it stops.
Okay, good. So this is just to test your conductive hearing, okay? So let's say you didn't hear it on one side, then we'll be concerned for conductive hearing loss on this side. The other test is the Rhines test. So again, I'm gonna slam it against my palm. It'll be vibrating. I'll put it behind your ear and then flip it. You let me know when you're done hearing it. I'm gonna flip it over and you let me know when you're done hearing it on that side, okay? So it goes up behind the ear. Okay, I'm gonna flip it over.
And right there.
Okay, good. We're gonna go ahead and do it on this side.
Alright.
And flip it.
Right there.
Okay, good. So this test is the Rhines test, and it just checks your bone conduction hearing, so bone conduction and air conduction. So if you had any issues listening to when it's flipped over, then we would have like an air conduction hearing loss, okay? So that's that. The next test is called the whisper test. So I'm just going to use my finger. I'm going to cover your ear on this side and whisper something on this side, and then you tell me what you hear, okay? 5, 6, 7.
5, 6, 7.
Okay, we're going to go ahead and do it on this side. 3, 2, 1.
3, 2, 1.
Okay, so that's called the whisper test. The next thing we're going to do is going to use the otoscope. This is a tool, and this is going to help me look into your ear. I'm going to look at the eardrum, okay? So since you're an adult, I have to pull the pin up and back so we have access to the ear canal. So let me look. Okay, we're looking at the tympanic membrane, which is the color on this side is a pearly gray, which is what we want to see. We don't have any redness, any air bubbles, and no drainage, so that's good. Let me check on this side. Okay, pretty much the same on both sides. You don't have any issues with your ears?
No.
Okay, so that's good. So we're gonna. Do you have any issues with your eyes before we get started?
I have LASIK.
LASIK. Okay. So I'm looking at your eyes. They're symmetric. There's no droopiness, nothing like that. And No swelling. I do notice a little bit of swelling on your right eyelid, but you did tell me that you had a little bit of a sty, right, for the last few days? Okay, but it looks like it's coming down?
Yes, ma'am.
Okay, good. So I'm just gonna go ahead and pull your eyelid down to check the conjunctiva. It looks, the bottom part of it looks like pink, so that's good. And I'm just gonna pull up on this side. I won't touch this eye. Make sure we have white. Okay, we don't have any redness or swelling or anything like that. This side I'm not gonna touch because it is a little bit sensitive for you. Your eyebrows are symmetrical. I don't have any issues with that. So we're gonna check your visual acuity. So I'm gonna use my pen light, and we're gonna be checking the corneal light reflex. So I'm just gonna go ahead and put this right in front of your eye, and I'll do it on both sides, okay? Okay, good. So that's just testing the corneal light reflex. We're also going to check their pupillary light reflex. So I'm just going to kind of cover this side here. I'm going to come around the side here. Good. Good. Okay. So we have your eyes get constricted, your pupil gets constricted with the light. Okay, so that means that it's accommodating. And we're also going to be checking for accommodation. So if you can just follow my pen light. So what happens is when I put this closer to you, your eyes dilate, constrict a little bit, and when I bring them out, they dilate a little bit more. Okay? So that's good. Let me see what else we're going to be checking. Peripheral vision loss. So this is a different kind of test. So I'll have you cover this eye with your hand. I'm going to cover my eye. And when you see my hand on this side, you let me know.
Okay.
You see it?
Yes, sir.
Okay. Cover this side. Cover mine.
I see.
Okay, good. So that's just checking your peripheral eye vision. Okay, so you have a good peripheral vision. The next thing we're going to check is going to check the cardinal gaze test. So just follow my pen light. Okay, so that's also testing your cranial nerves, so that's good. And we have this tool which is called the ophthalmoscope, and this is going to be, I'm going to be checking your eye and to find the optic discs. Okay, so you might be a little bit uncomfortable because I do have to get a little bit close to you. Okay.
Sure.
This way. So what I see is the optic disc, and it's an orangey color disc, and I see some blood vessels on there. So that's the only way to see blood vessels is using this tool, the ophthalmoscope. And the last test we're going to be doing is called the Snellen chart, which is the one that we have to stand 20 feet away, and then we'll determine your vision. So if you can just stand here, and I'll have the form right here. Just go ahead, you can see. Just see like some letters here.
7, 8, 3, A, B.
Okay, good. So you're at a 20/20, which is what the population vision is. If we can read section line 9, let me know. Can you see line 9?
Yes.
Can you read it for me?
T, S, K, D, L, O.
Good. So you have 20/15 vision, which means that you have really good vision, but you did specify that you had LASIK?
Yes.
Okay, which is that. So that's good. And that concludes our exam for today. Do you have any questions for me?
No.
Okay, thank you so much.
Thank you.